Welcome everyone to our COVID-19 webinar, The World After COVID. Can you believe this is the 26th webinar that we have conducted on the topic of COVID-19? And this is in the 17th month of COVID here, our experience in Ontario. So this is the topic today, the world after COVID. Dr. Doris Grinspun is our host, and she's talking about worries about the future of healthcare and the world's people's post-pandemic. So we'll be talking, kind of honing in on some issues around global disparities, inequitable access to vaccines, collapse of the global nursing workforce, or potential collapse, and long-haul COVID. We'll have plenty of time for your questions, answers, dialogue, and some calls to actions throughout the webinar today. My name is Susan McNeil, and I'm part of the senior management team. We have a whole team together with us here, and thank you to everyone. Olivia Clay behind the scenes supporting the webinar, and Andrea Stubbs as her backup. So thank you, Andrea. Jean Baynock, who is supporting our chat box and Q&A together with me. And then we have Raul Pinto and Renee Dunkley, who are supporting some of the social media aspects, promotions, and communications today. So thank you to all of the team, and welcome to all of you today on the line. So the webinar is being recorded and will be posted on our portal. We ask you to please use the chat box for questions and comments, and we do have the opportunity to unmute your line perhaps a bit later on. And always a reminder to you to refer to the RNAO portal for up-to-date information. We have an extensive portal that is there for you, so please use it. And again, welcome to today's webinar, and let's go ahead and get started, Doris.
Thank you so very much, Susan, for organizing this, first of all. And we chose the topic, and the title, I think, is the most telling, The World After COVID. Well, is there such a thing, right? Is there a world after COVID? And what will that world be? And let me start by saying the following. Dr. Tedros, the World Health Organization Director General, said recently that the world is at risk of vaccine apartheid. The WHO chief highlighted that at least 63 million doses, 63 million doses of vaccines have been shipped to 124 countries and economies. But that represents just 0.5% of the combined population of those nations. Look at the enormity of this. Look at the enormity of that sentence. We have shipped 63 million doses of vaccines, and yet that is only less than 1%, 0.5% of the population, of the combined population of nations. He also noted that the basic problem of vaccine inequity was a lack of sharing by the wealthy countries that have accumulated most of the vaccine supplies. Some of you were in shock when months and months ago, I called Canada and our Prime Minister for being the country that actually had the most vaccine purchasing of all, that we at the time had vaccines for 7 times the population of Canada. And while one can understand the politics of it, and certainly looking now from the rear mirror, you absolutely can understand the politics if Canada had not bought all that vaccine, because Prime Minister Justin Trudeau and his team was accused of not having enough vaccines, right, by the opposition party, the Conservative Party, right? You may remember. And so you can understand why each one of these leaders tries to accumulate as many as possible vaccines to protect themselves politically. Meanwhile, that will leave other countries naked of vaccines. Public health experts estimate that approximately 70% of the world's 7.9 billion people must be fully vaccinated to end the COVID-19 pandemic. Again, we are at 0.5, and what's needed is 70% of the 7.9 billion people need to be fully vaccinated to end the pandemic. So when we call this webinar Life After COVID, well, time to reflect, colleagues. As of June 21 of 2021, 10.04 of the global population had been fully vaccinated. And that includes, of course, countries of the OECD. So it jumps from 0.5 for the poorest countries to, even when you include everybody, it's 10.4. But to end the pandemic, we need, as per the WHO, 70%. So again, reflect on that. Nearly all of them, of course, that raised that bar from 0.5 to the 10% that I just mentioned are in rich countries. Only 0.9 of the peoples in low-income countries or low-resource countries, as they are called, have received at least one dose. 0.9%, that's nothing. That is nothing. So what are some of the good news, but then the caveats? Canada has committed at the G7 meeting to donate up to, so it's not clear how much, but up to 100 million vaccine doses to help poorer countries beat back global pandemic. Many billions of doses are required, though, on a global scale to achieve herd immunity. And let me remind you, herd immunity is achieved through two means. One is the vaccines, you get vaccines. The other is you get the COVID. And we will talk about you get the COVID if you don't get the vaccine in the third part of today's webinar, which is what are the consequences of you get the COVID. Simple said than those that get it. So it is the view of RNAO, as it has been all along, and we have written in my blog, I have written about vaccine justice. Dr. Tedros is talking about vaccine apartheid, stronger words, but it is the view of RNAO that unless we start to look outwards to the entire world, we ain't going to be done with this. So while we may, in the winter or later on, have a third dose of vaccine to give a booster to the rich countries, the poor countries have not received the first dose. So this pandemic has created a bigger and bigger gap between the haves and haves not. And why do nurses need to be worried and the public at large? Number one, because we live in one world, whether it's climate change or whether it's poverty or whether it's COVID-19, we live in one world. And for those, and I'm not saying in the group of over 100 people today that are selfish enough to look only to ourselves, well, even then, because you are going to get more variants. We already have the Delta variant originating in India. We already have the Lambda variant originating in Peru. And we will continue to have variants that are more aggressive because the viruses mutate, that's their job, and that will go after more and more people. And while in Canada, they will continue to go to the most vulnerable populations because they are at more risk of contracting the virus if not vaccinated. In other countries, those vulnerable populations, especially in the low resource countries, there is a vast number of the population. So we need to pay attention to vaccine equity. We need to push vaccine equity in your workplaces. We need to push vaccine equity in any forum that you encounter yourself, and speak with your families and your colleagues and your friends, because they all have family members. Many people in Canada, in Ontario and in Toronto in particular, but in other big cities, we all have families in those less well-to-do countries where people are getting sick every single day. And because the more the virus becomes aggressive, the more people, even that are fully vaccinated, will get the disease. And I will talk about that today. Remind me, Susan, about here in Toronto, here in Ontario, here in Canada. If you are fully vaccinated, can you still contract the virus? The answer is yes, because vaccines do not protect you 100%. Can you transmit the virus? Yes, you can. It just, you save your life. And that's critically important, right? And your symptoms and your share of the virus is not as much as otherwise. So getting the vaccine is still very important, and getting the vaccine for the great majority of the population in the world, as WHO is calling, is critical. I will take share slides if I can. Okay, that's good. That's perfect. I would like to hear, please, I would like to hear the video, Susan, if we can put it on, where it says the idea that everyone is protected and it is kumbaya is a very dangerous assumption, because it's not only dangerous, by the way, for other countries, it's dangerous for our own country as well. You know, things are not back to normal, and we should be thoughtful in addition to issue of vaccine equity. The sound is not there.
Curve. This is an increasing curve. Making assumptions that transmission will not increase because we're opening up because of vaccine is a false assumption. Transmission will increase when you open up because, number one, we don't have vaccines in everybody, and number two, the vaccine coverage rates are lower, and we're not still sure to what extent vaccination protects against the ability to be infected. This means with increased transmission in the community, we then put our most vulnerable at risk again. It's about preventing being exposed to the virus and preventing you exposing others to the virus. Look around in your community, know the local numbers. If the virus is present in your community and transmitting, and you're a vulnerable person and you're not vaccinated, then you are potentially going to be exposed. So the idea that everyone is protected and it's kumbaya and everything goes back to normal, I think right now is a very dangerous assumption. Anywhere in the world, we would ask government to be really careful at this moment, not to lose the gains you've made, to open up very carefully. This virus is evolving, this virus is changing, and we need to be very, very careful at this moment so that the gains that have been hard won by the behaviors and action of our population are sustained. Individual behavior and government support to that behavior, extremely important. And I would urge extreme caution in the complete lifting of public health and social measures of this kind, because there are consequences for that.
And of course, Dr. Ryan is referring to what's happening in UK, right? That there is a lot of criticism about the reopening, you know, so broadly, etc. He was referring likely also to Israel. Israel had parties in schools of kids throwing their masks, etc., only to 10 days later go back to the masking, only to now having hospitals again becoming fuller. And he's warning probably the US. I mean, you have seen these events of you know, Florida, for example, right? No masking, and these sport events where you have people screaming, right? Screaming from the top of their lungs. And yeah, people assume the next person is vaccinated, but actually there is no green pass like in some other countries to really know that they are vaccinated. So he is warning caution to everybody because yes, we have made gains, absolutely yes, but we need to be careful that those gains are sustained, and more than only sustained in our own countries of OECD, well-resourced countries, developed countries, that we actually be more generous even than what some have been to ensure that the world's population has the vaccinations needed so that we can put an end to this terrible situation, because it is a terrible situation. People are tired of it. But if you think we are tired of it, let me tell you, others are equally or more tired when they have less resources. Next slide, please. And this is why we have this action alert. And I say it with sadness. I say it with sadness, colleagues. This is one of the action alerts that we have had the lowest response rate. I don't even think that we have reached 500 people answering this action alert. And this is about asking our Prime Minister to follow the lead of President Biden, right, to ensure that a patent waiver, which the Prime Minister has not done it. Because once you have a patent waiver, other countries can develop vaccines very fast, and other industries can develop develop vaccines much, much faster. And I don't think we should shy away of saying that some of the big companies like Pfizer have made I don't even know how many billions on the vaccine. And while we are grateful that they develop a vaccine, this is a pandemic, and pandemics are worldwide. And we need to get over the pandemic. And for that, without a patent waiver, you know, I don't know how long it will take. We can't wait till 2023 or 2024 to continue with this type of difficult conditions that we have at home and abroad certainly is more difficult than here. Next one, please. So please do sign that action alert. We really beg you to sign. This is something that is being talked less, and I think we will start to call it, Susan, health human resource justice. The same as we call it vaccine justice, we will call it health human resource justice or nursing workforce justice. Because one of my fears, and why we included this in this webinar, is that while we're tremendously concerned with the crisis in nursing human resources here at home, and we are, because our survey says that more people will be leaving the profession, we are equally concerned about what the world will do, especially the well-to-do countries with the less fortunate countries when they are in a crunch for nursing human resources. And as you know, what has happened without the pandemic has always been poaching, right? Perhaps less in Canada, not perhaps, for sure less in Canada compared to the US, and that's thanks to organizations like RNAO that have said, no, a human life in Africa, a human life in Latin America, which are the two countries, by the way, that have at this point the largest per capita contracting of the virus. So the largest number of cases right now per capita are in Peru and Brazil and a few other countries in Latin America. So Latin America as a region, followed by Africa. If you think in Latin America, in many of those countries, nurses study 5 years university. Just picture how the US and Canada may go and, you know, attract those nurses to us. And always it has happened that we go and poach from African countries. Well, so not only we will leave them then with vaccine apartheid, as Dr. Tedros is calling it, are we going to do the same with nursing human resources? Just picture the catastrophe that we will create. And again, that is in itself awful for those countries, which are 90% of the population of the world, if not more, right? But also, it's like a ball that bounces. It's also catastrophe for OECD countries because the virus will mutate even more than, and again, we will be on a crisis. And there will come a point when the vaccine will not be effective unless we start and get ahead of the curve of the virus. Next one, please. So this is our own data here in Ontario, 26 to 30%, right? Age, you can see there that 13% are saying very likely to leave the profession. Very likely to leave the profession. If you take that plus the 9.5%, you can see what it is. Usually, just so you know, that number hovers around 4%, 3.5%, 4%. And if you look at the age 31 to 35, again, huge number, right? So these are people, colleagues, that have 30 years ahead of them to give to the profession. This is why RNAO is so focused, laser focused on retention of the 26 to 35-year-old and even to the 40-year-old in terms of retention of talent, of human resources of RNs in the profession. This is a prime focus of RNAO on retention. And then the second cohort that is important to look is the cohort that is your older cohort that is they have the capacity or the possibility financially to retire and the age possibility, which is the 56 to 60, right? You can see there 10% or almost 13% that are saying they're likely to retire. In that cohort, there is a big difference between the two cohorts. In the earlier cohort, the 26 to 35 is usually your frontline staff nurse, that we are going to lose 30 years of investment that they did in the profession, 30 years of investment that Ontario did in the profession, 30 years of investment to serve Ontarians will be wiped like this, which is significantly more than the usual attrition. In the second cohort, the 56 to the 60, and it actually goes on to over 60, that is usually the most prevalent there are senior managers in nursing, like chief nurse executives, middle managers, and faculty of nursing, which is your layer that builds the rest of the profession, that supports the profession forward. Without faculty, how do you educate new people, right? So we also have an issue with that we need to ensure that we create the conditions for them to give us a couple of more years. Next one, please, Susan. So this is why, as you know, we have 3 surveys, 2 that have been completed, which is the work and well-being survey that I just presented key results to you. The second one is the healthy professional worker. It's a nursing case study of 7 professions, and nursing is one of them, and we're very involved with them. And we will have the results of that and some work on that in late August. And then the third one, which we will ask you to please respond, and we are thrilled to share that last week there was a 50% increase in the response rate, so bravo. We want you to continue to respond to the International COVID-19 and Nursing and Wellbeing Survey. Please, 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 Irma Jean will put the link for you there. Please respond to that survey. It is there till July 31st. You will get weekly reminders directly from me. We need you to respond because what that does, that compares about 150 countries and what's common and what's different between us in Canada. And by the way, that survey is for everybody. RNs, RPNs, LPNs, NPs, nursing students in Ontario, in any jurisdiction in Canada, where you are a member or not a member of RNAO, where you are a member or not a member of We RPNs, on, etc. You all, we invite you to answer. Colleagues from other jurisdictions, we will provide the reports to everybody that is participating with us in promoting the survey. A special thank you to CUPE that just notify me that they will be distributing the survey to their members. So kudos, thank you very much to Charlene from CUPE. and that will get us a good response rate for RPNs. It's already good, but it will be better. And several other national organizations, Linda Silas and her team in Ottawa sent a beautiful email inviting all the jurisdictions in Canada with CFNU to respond to the surveys. Thank you, CFNU. Thank you, Linda. And be assured that you will be recognized as a collaborator in the survey, and we will give you also the results of it. So together then, we can expand the program that we have in a way that is responsive to what nurses are saying to us. So we took some of the comments. We received pages and pages and pages of comments, and thank you, Kim Jarvie, Senior Economist at RNAO, Matt Calway, Director of Policy, and all the colleagues in policy that analyzed the work and well-being survey. And we identified themes. In addition to the numerical numbers, we identified themes. Those themes we transformed then into questions in the international survey for people to rank if those are initiatives that they think will retain people in the workplace. And of course, we will continue to do focus group. We will continue to bring it to these webinars so we can brainstorm with you and create programs that are responsive to you. We know that the Healthy Professional Workers Survey from Ottawa will develop a toolkit specific to mental health supports. Our program will obviously have linkages to these other excellent resources that are being developed and that we are partners with, and also will develop additional resources to support in retaining nurses, number one, and recruiting more nurses. And with that, let me give you a good piece of news in Ontario. And it is that during Nursing Week, the Premier did announce an increase of 800 RNs and about 1,200 RPNs in addition to the usual uptake in nursing schools. So 800 more baccalaureate prepared nurses are being accepted already for this fall. But remember, that takes 4 years, right? Also, let me tell you that I am part of the Acceleration Committee of Long-Term Care, a Human Resources Acceleration Committee, although I cannot, of course, it's not my place to provide details. Yes, 800 for Ontario. 800 for Ontario, I'm answering to someone that asked. 800 RNs, in 800 baccalaureate applicants in Ontario are being added this fall, yes. In addition, we, in the Acceleration Committee, we are doing excellent work, I do need to say, in relationship to bridging programs, to preceptorship, to mentorship. We are also talking, and it's one of the areas that RNAO is pushing, so I can comment on that, on prior learning assessment, the bridging from PSW to RPN or PSW to RN, because both are doable and we have excellent examples. And Susan, will be great to bring Diana at one of the future webinars, maybe to have a panel, because Diana is an experienced PSW that is starting her program at Ryerson, the baccalaureate program. Will be great to bring some people that are experiencing moving from one category of healthcare worker to another, in this case, PSW to RN. I'm sure that there are many PSWs to RPN, RPNs to RN, etc. And yes, also colleagues from RN to nurse practitioner, which is a must if we are going to provide better services, especially and not only for vulnerable populations. The work of nurse practitioners during COVID in long-term care was second to none. And the work of nurse practitioners, in addition to long-term care during the pandemic, in people that experience homelessness, the same as RNs and RPNs through AICHA, was second to none. So again, it will be good to profile some of those good news stories. Yesterday, and I will send it to people, or I will post it in my blog on Friday, there came a consensus paper from WHO, from leaders around the world, of what are the 10, 11 things we need to do post-pandemic to really get us through this bump and this difficult situation where people are exhausted. And one of the issues was to also recognize, to celebrate what went well, to celebrate our front line. And also, I want to make sure that we understand our management team in healthcare organizations, because yes, front lines were in the front lines with patients. Also, though, managers and chief nurse executives were in the front lines of pushing agendas in the boardrooms. And faculty, they were in the front lines of transforming curriculum. So every single role is important. And how do we celebrate the contribution so people feel energized and motivated? Next one, please, Susan. So this is, we will continue to ask for this. One way to celebrate the contribution of healthcare frontline providers is to, I would say, not just exempt nurses and other healthcare workers from Bill 124. I think we should call it Repeal Bill 24. Because Bill 124 was, even when it was conceptualized in the view of RNAO, was not the right thing to do. There is a role for labor organizations. There is a role for unions. And RNAO always has respected that role. And their role is to negotiate fair wages. And yeah, maybe it would have ended up pre-pandemic at 1% because of what was happening. Maybe it would have ended at 1.5, maybe at 2. I don't know, right? But now it's post-pandemic. These frontline care providers gave their lives. And I'm not underestimating. Some lost their lives, whether PSWs or RNs or RPNs lost their lives. Doctors lost their lives. Now, doctors are not part of Bill 124, as you know, because they're not employees, right? So they have a separate negotiation. But nurses, all of them, and PSWs for the most, are, part of organizations that negotiate their wages. And we are saying to the Premier, time to go back to the drawing board. One big way to acknowledge that the heroes are heroes is repeal Bill 124, whether it's for teachers, nurses, or others. So colleagues, yes, on this one, we have over 5,000 people that responded. Please continue to respond. It is critical that this bill be repealed. It is one concrete, tangible way that the government and Premier Ford can actually say, we listen to you, and we are doing it. Next one, please, Susan. Have your say. I told you about the survey, July 31st. Your stories are very compelling. Your answers are very important. That is the link. Yes, we are thrilled that the response rate went up by 50%. Yes, you are going to continue to be backed by me, that you need to respond, but here is the link. Please take upon yourself to ask your friends, ask your colleagues, bring it to your workplace. If you need, we can send you the flyer. Just write in the chat and we can send you the flyer. And maybe Susan and Irmajin, we can post the flyer in the website and people just can uptake the flyer exactly the way it's here. Exactly the way it's here. This is not an RNAO survey. This is a worldwide survey. We need your stories. We need to hear from you, whether you are in Ontario, whether you are in Alberta, whether, by the way, there is a great campaign that I tweeted on the weekend that is called Pay Them. Pay Them. If you hashtag and see Pay Them. So I used that to, first of all, I retweeted and supported them. And then I said to the Premier, pay them, repeal Bill 124. So, wherever you are or your friends or nursing colleagues are in the country, please ask them to respond to this survey. It's critical. It's critical. There are 2 weeks left. We need you to respond. Let's reach 5,000 responses. Let's aim for that. Next one, please.
So Doris, the next slide has to do with the third topic. So I was wondering if you wanted to say anything about the tweet that you have, that you're challenging people to tweet their solutions to nursing workforce or health, human resource justice. Yeah.
Yes, thank you. First of all, a few things. I want to talk about tweeting in general for a minute. I think that while it's very important to point out to all the holes in the system, and there always have been many and will continue to be, it's also very important, if we don't want to collapse the profession, to also tweet about the good things happening in nursing. And anytime we put holes, let's put solutions. So I did at one point, and I plan, and our team is looking into that, a tweet about what are your solutions for a toolkit on preceptorship, for example. And we got a lot of fantastic ideas for preceptorship. Also, there was an article about the bonuses that were being given in Ottawa as well as in Windsor to nurses to come and work in different places. And the media called me and I said, bonuses are not the solution. They're not, because they just move people. They rob from Peter to give to someone else, and then the nurses move anyways to the next bonus and the next bonus and the next bonus. So what does that to the profession? First of all, creates instability. Second of all, it's not a permanent solution. So I started to give what were my solutions at the time, like bridging programs, like certifications, right? The certificate of specialties, etc. Those are build the profession up, right? Like repealing Bill 124, so compensation can be better. That builds the profession up. Like not having workloads that are super heavy, but actually workloads that allow to deliver satisfying care, so you feel good when you leave work. Those build the profession up. And then I said, what are your solutions? And lots of people put fantastic solutions. You will see us doing more of those tweets. And please know, we use them after. We use the ideas. We absolutely use the ideas to build the next. So that is important. And I would encourage any of you to start those type of tweets, because it introduces excitement and solutions, right? It's not to say that we shouldn't be mentioning the holes, but I think it's to give a balanced approach. And if we do bring holes, let's bring also the good side of it. Is that what you were referring to, Susan?
Exactly. Yeah. Yeah. And just to let you know, there's been some chatter in the chat box, but nothing outstanding in terms of questions at this stage. So do you want to move on to the third topic then?
Absolutely, sure. Okay. This is an unpleasant topic, I must say. And it came to me, and I wrote on the blog, I did some research and wrote on the blog this weekend, out of talking with colleagues in other countries. Because here, believe it or not, we don't speak enough about this. It's like either you live or you die. You live with the vaccine, you die without the vaccine. Well, it's more complicated than that, right? Not always you die without the vaccine. Sometimes you live after those machines where you need to be for a long time in the ICU, some people for weeks, right? In the ECMO machine. But when you come out of it, how do you come? And for how long do you come? And do we even have services for these individuals, which we don't, right? And then it really came hitting to me when I met with PG. We did the preparation of the training for the next cohort of public hospitals in Chile. And one of my colleagues, 34-year-old, which I knew she was ill with COVID because she spoke with me about a month ago. And about a month ago, I remember our colleagues from Chile and I, all we wanted was for her not to speak because she hardly could get her words out. So we were so concerned that we were taking literally oxygen out of her by trying to speak. She's the one that directs one of the initiatives. So we said, just be. what happened with this amazing colleague of mine, and she's pretty open and public about that, and she will be more than willing at some point to come and talk with you if you want. Her name is Macarena. She's an amazing woman that gave birth during COVID. And she was advised not to get the vaccine because she was breastfeeding. Well, she got COVID. She got COVID, and when she showed me her arm this couple of weeks ago, I couldn't believe it. I couldn't believe the bumps of vascular disease in her arm. I couldn't believe that she told me that now she had glucose problems because she had been so long in cortisone. And as you know, that can mess up your glucose. I couldn't believe so many of the things she said, but I did because I saw her with my own eyes, right? And I went and I started to read about this. And the articles, peer review articles that I put in the blog is articles you need to read. We do a disservice to Ontarians by not speaking, and I don't know if Renee is here today at the webinar or not, but Raulito I know is, and maybe Renee too. So Raul and Renee, Renee is, I can see her. Renee, yeah. tweet that blog, please. People need to hear, people need to hear what happens to people that are long-haul COVID people. People need to hear that getting the vaccine is important, not only because you don't want to die from COVID and leave your family and loved ones without you. You need to get the vaccine because you don't want to be a long-haul COVID. You want the least damage to your systems. And we know today, and you will see that in that blog, that COVID is not a respiratory system dysfunction. COVID is a multi-system disease. So I absolutely urge you to go and read that blog. If any of the 100 and almost 50 people here today do not receive the blog, please put your email on the chat. We will make sure that we include you on the blog. All the members receive the blog automatically. But if you have not received the blog, we send them every week. Every Friday evening, I'm working on the blog, and you get it either Saturday or Sunday. And anything I put on the blog is well researched. So please, please, please read the blog and share with your colleagues. Not to scare them, but it is scary. It is scary, I tell you. But to alert them that they need to get the vaccine. They need to convince as many people as possible to get the vaccine and to be fully vaccinated. Now, let me talk about fully vaccinated. Fully vaccinated is the 2 doses. And fully vaccinated, up to recently, we thought is 14 days after the 2nd dose. There is sufficient research to show now that is 28 days after the 2nd dose. It's not that after 14 days, you haven't reached a good peak. It's that the immunity continues to build for 28 days at least. So please be thoughtful. You heard again WHO. Be thoughtful. When you are fully vaccinated, it doesn't mean you just throw away your mask when you go in the bus or you go in, inside places, unless you are convinced that the 2 people next to you in your home, if it's your grandkids, for example, that they are at an age that they were vaccinated. You need to be thoughtful. Outside is a different story if you keep space, right? Outside, if you are in a park and there is enough space between you and other groups, you can go without a mask. Outside, the virus doesn't catch the same as inside. So be thoughtful about that and know that it's not good that in Canada we're not talking about long-haul COVID enough. And it's not good that We are confusing, for example, comments of Dr. Moore, who I may invite to a future session, a fantastic new medical chief officer of health we have in Ontario. And he did say that kids in September may need to go with masks again to school. And the tragedy to me was the reaction of people. What do you mean? Then why is good to have a vaccine? You know, it's so, I said to my grandkids, the 13 and 10-year-old, I said, you know that you may need to go with mask in September, likely, and likely I will be asking you to go with a mask in September still. They said, what's the problem, Safti? No problem at all. And the young one said to me, I even prefer the mask. It's better in the winter. It's less cold. Like kids are so moldable, right? Why to already make a story that having a mask is not a good thing before we are sure that it's okay not to have a mask? And now we know that the virus is aerosol. And now we know that ventilation needs to be fixed in schools and has not been fixed enough yet. And also we know that we will not have likely the 12 and under vaccinated. We don't have a vaccine ready for them. So, you know, while the 12s and up hopefully will be most of them vaccinated, and teachers hopefully will be most vaccinated, even in that segment will not be all. But then you have this 12 and under that will not be vaccinated. So will we need to be having a mask? Likely, yes. And what's the big deal if we do, right? So I think we need to remember that too. Next one, please. Let's just hear comments. I want to talk meanwhile that you can look, you and Imagine and others can look at comments. You can read comments, but also questions. Let me comment about the type of vaccines. I think we created a communication mess, right? When first we went after AstraZeneca, then we went after other things, right? Then after the mixing. It's well known in vaccines that you mix and match vaccines. This is nothing new in the science. So for AstraZeneca to then get whether it's Pfizer or whether it's Moderna, it's not an issue. It is not an issue. And when you see in the lineups that a percentage of the population goes and gets the shot, and the other percentage starts to scream, you didn't tell me it was going to be Moderna, etc., etc. Guys, let me tell you, I am Moderna double. I have zero issue. I'm delighted. I'm Moderna double. And if it would have been AstraZeneca, like my kids, AstraZeneca and Moderna, lovely. Get the vaccine, whatever it is, because no vaccine, you have more chances of getting COVID and having a difficult outcome and more complications than if you get any of the vaccines, any of them. So get the vaccine and convince your family and your loved ones to the same. I will stop for a minute, Susan, and you can tell me if there are questions or comments.
Sure. There are a couple of questions about children under 12, questions and comments. So P. Shaw is saying that there are no guidelines given for those less than 12 who are not vaccinated. You've started to talk about this, just wondering if you have more to say. There is info about those vaccinated, but still nothing about little kids who aren't vaccinated yet. And adding to that, Aaron is tired of the message that kids don't get sick, and is also wondering about long haul COVID in kids. So I can repeat.
I will talk about several things, including about the issue of pericarditis in kids that have been vaccinated. Let me start with that, just in case you hear about that and you are not, and you are in the know. So there are a few incidents, not many, not in Canada at this point, but yes, in other countries, of kids that got the Pfizer and in the second dose, they got pericarditis. It's a type of pericarditis that was treated, and that's important to know. Did my grandson, and I knew this, Did my grandson, 13-year-old, get vaccinated? Yes, he did. Okay, he did, and he got the 2 doses. And when do the symptoms show up? Just so if you have family members, etc., you know, it usually shows up the 4th day after the 2nd shot, and it's between the 4th day and the 7th day. So was I in the watch? His parents know, by the way, but was I in the watch for any symptoms at day 4? You bet I was. Did I ask him a lot? No, because then you put things in the heads of kids, right? But I was in the watch, right? And then did I breathe at day 7? Of course I did. I'm a grandma, and I'm aware of everything that is going on. So I'm passing it on to you. The chances of dying if you get COVID and you are a kid, I don't need to tell you, you saw that already in the news. It has happened. The chances of having way more complications in much larger numbers if you're not vaccinated on kids is out there. And if you want me to write a piece on the blog on that, I will absolutely be happy to do that. The issue with the under 12-year-old is that the vaccine is not ready. My understanding is that the only vaccine that is being trialed for that, and if I'm not wrong, is being approved already in the US, is the Pfizer, and is for under 12. And I don't recall if it is from 5 or 7-year-old, but I will check on that and I will put that in the blog. The issue that kids don't get sick is absolutely, you are right, Erin, inaccurate. Kids get sick, kids get complications, and kids share the same load of virus as anybody else. So important. I see that someone already put there, Erin put Pfizer is supposed to have data September 5 to 11. Here you go, 5. Very good. But leave that there for a minute. September, right? I think it will happen before September, Lynn, in the US, because Erin, because I think they will want to move faster because they're so much politically at risk of not moving fast that here you go, right? But not here. I don't think that in Canada, kids will be vaccinated anytime soon because number one, we will not have enough of the Pfizer vaccine. The US will do first. Number two, NAS is always slower in moving. I do think that November, December, we will start to see vaccination here soon after the US, and if not, early in 2022. That's all to say that as the WHO video mentioned, that alongside with vaccine is public health measures. You have heard RNAO all the time saying that. You need to suffocate from both sides and both government and individuals, right? So basically vaccine on one end, public health measures of not reopening, like throw all your masks and go to, indoor places of 300-person wedding that you don't know even if they vaccinated or didn't vaccinate, etc., and then regret, right? That's one thing. And the same with schools, prepare the schools. While September and October may not be an issue because you can have all the windows open, come November, December is cold in this nation of ours, and in Ontario in particular too. So you will need to have the windows closed, which means this is a virus that spreads much faster indoors. We already know that. If you don't have proper ventilation, here you go. And if we let the kids without the mask, here we go. And if not all the kids got vaccinated, which will be the case even in the best case scenario, here we go, right? So those things need to happen. And these are topics that David Fisman has been speaking for a year. You have seen that in my blog, for a year. It's aerosol, prepare the ventilation. It's aerosol, protect yourself inside places. And, and Dr. Bogosh in the weekend spoke with Minister Lichi and alerted him to the issue of ventilation, etc. I did express on the weekend that I am concerned for the winter in terms of, again, needing to close the schools. And the tragedy is that it will not be all the schools everywhere. It will be in vulnerable areas, right? Whether any community that is not strong in uptake of vaccine because of vaccine hesitancy or because it's inconvenient to go to get the vaccine and travel for an hour or wait on a lineup rather than bring the vaccine to the places. And also those at-risk communities, their schools are less well-resourced, so their ventilation may be even more compromised than in other places. I mean, this is the time to fix schools, guys. We have banks, with all due respect, we have banks with marble counters, marble bathrooms. Maybe it's time to have schools with marble ventilation that is marvelous, that is fantastic, because this is not only good for COVID. This is good for colds, this is good for flu, this is good for many other things. So maybe it is time to invest in schools. And yes, someone asked me in the winter, and does the issue of small class sizes still count? Yes, it does. Because if you already, we know that we have Delta, which is dominant in Ontario, which is 50% worse than the UK back then variant, 50% worse. We also know that Lambda originating in Peru is 50% worse apparently than Delta. Just think what will be, even with those two. And think if another one that is worse. And let me remind you of the beginning of this webinar today, which was about WHO saying to us that only 0.5% of the poorly resourced countries, of the poorest countries of the world, have been vaccinated. That's nothing, right? That's nothing. Or whether they said that 10.5% of the world's population, that includes the rich countries, have received a double dose, which is mainly in our rich-to-do countries. So it all goes back to a circle, right? That mutations will continue. That's the job of viruses, guys. They're not asking us permission. They don't take the weekend off. They don't take a summer off. They don't sleep. Their job is to mutate and catch people without the vaccine. That's their job. That's their job. And it will continue to happen. So it's our job as nurses. Nurses have the highest public trust. It's our job as nurses to continue in the social media to entice, to energize, to create a hip, to hype, not hip, hip and hype, to impress upon people to absolutely uptake vaccination and uptake full vaccination. It is our job as nurses, because that's the way we are educated, to talk about vaccine justice, because not only we understand epidemiology, that unless we fix the entire world, we don't fix our own little community. Whether it's inside our own country with vulnerable populations or the world's countries with vulnerable populations. And nurses need and must take a lead on speaking up on those issues. Other comments or questions?
So Doris, thank you so much for that. I'm looking at kind of some themes in the chat box and what you're saying. So you're saying, our job as nurses is to hype and keep up some key messages. So in the chat box, people are echoing a bit of what you're saying here. Well, a lot of what you're saying here, that there are, people going back into open concept offices without masks. So, you know, that is happening, and I think, I'm sure you're aware. And also sort of people being a little choosy about vaccines. Oh, I'm going to, you know, not get it today because I've heard this one has less side effects, or, you know, I want to, I'm worried that if I have 2 different mRNA vaccines that I might, you know, have difficulty traveling to other countries. So can you, like, as nurses, can you think of, like, maybe there are a couple of key messages you'd want all of us to be?
So yes, so I will put in the chat, or here is what we will do, Renee. We will work on the website on putting messages, and also I have fantastic pictures. I have a picture that someone gave me, the one that says, this is our shot. That's a very common one. But there is another one that says, you miss 100% of the vaccination if you don't get the vaccine. It's a very good picture. We need to say to people, any vaccine is as good, is good. Number one, period. Any vaccine is good. Any mixing cause vaccine is good, because otherwise they would not have been approved. And as for other countries, at the end of the day, they will need to accept any of the vaccines in any mix and match, because the world needs the business community to continue. Not only businesses and, you know, big businesses traveling, but actually people to go to those countries, tourism, etc., visiting the families, and you name it. So my view is that it will not say which vaccine you got anyways, the passports that there will be, and they exist already in some countries, but the proof that you got vaccinated, not which vaccine. And many countries will continue anyways to do the test before and after you come. They will, because of the mutations. So I hope that helps.
That's great.
Actually, Doris and all, never have we ever mentioned actually the company that made the vaccine when we talked about vaccines in the past.
Never.
This issue of talking about the Pfizer and the Moderna is totally new. Like, would anyone know who made their smallpox vaccine? I mean,
yeah. Angela, to your question about Senova, I think it is, the vaccine from China.
yeah.
Number one, let me tell you that Chile is the only vaccine that gave, okay? The vaccine from China is approved by WHO. So I don't think she should have a problem. Chile is in the no list of Israel, not, and I know because of family, and I am not sure of the US, not because of the vaccine, but because the cases are so high in Chile. The cases are very high still in Chile. So that's why, but I don't think that should be a problem, but Angela, I will check for you and I will let you know.
Doris, there's a question about preventing vaccine mix-up. I think that was a case in the news about giving saline instead. Is there anything we can do to prevent, or is that a problem?
Saline? What? I never
heard that.
I missed that.
So this is from Steffi saying, we hear a vaccine mix-up like saline being given to people in the GTA. How does something like that happen?
Well, that's fraud. I call it fraud. I have no idea. But if you send me the details, I will check. I never heard of that. I am sorry. That's bad. That's bad. That's like giving saline to a patient instead of the pain medication. But that's fraud. That's criminal. I don't think a mix-up like that just can happen. But please do send us the details so I can check on that. Because sometimes you need to be careful, that they are not just stories. And please don't tweet about that unless you have really evidence.
Maureen is saying that was a mix-up that occurred when reconstituting the vaccine. Oh, there's lots of action in the chat box now.
I didn't see that. I see that Zubeida is saying that CP24 had. I have no idea, but I do know the people in Niagara region. So that was an error. But how can an error happen like that? Oh my. That is bad. So 6 cases. So I am assuming they were called back, right? Yeah. I agree with the person writing, Connie, about the soccer events and hugging people and all of that, 200 people. Oh, that must be the CP24, 200 people called back. I'm reading different things, moving here too fast.
Okay, and Nicole is offering a suggestion to prevent vaccine mix-up, that her team mixes the vaccines together step by step, drawing up diluent at the same time, all the way with each step, double checking each other's drop of the vaccines. So,
excellent.
Thank you, Nicole, for sharing that. And just scrolling back, and Irma Jean, I'd like to call on you too to identify if there are any outstanding questions. I see there's a few here that are scrolling in, but I just want to go back to one from a while ago, Irma Jean, while you're looking, from Janet, just wondering if you have anything more to say, Doris, about implications of the vaccine in the first or second trimester.
So it's absolutely very, very, very clear that in Canada, as it should, the recommendation is to get vaccinated whether you are in the first day of pregnancy or in the last day of pregnancy. Very clear recommendation there, that the benefits outweigh any negative impact, that getting COVID is a bigger and more likely danger of pregnancy than being vaccinated. With that, I do need to tell you, and I tweeted about that a few weeks ago, that we are thrilled that a colleague of ours who was in an ICU, I tweeted about that, and whom I am in touch with the husband and with her now, but with the husband before, was released a few weeks ago from the hospital. By now, actually, she probably had the baby. I need to get in touch. And still though on oxygen, so it's not simple, but she was in ICU and she was not in a good shape for a while, and she was not vaccinated at the time. If you know of people that are pregnant or wanting to get pregnant or in whichever semester, or lactating or breastfeeding, please convince them to get vaccinated. Everything, whether, you know, they did a lot of, we spoke a lot at the time about AstraZeneca and the clots, remember? What was forgotten in that conversation is that without the vaccine, if you get COVID, you are 10 times more at the risk of a clot, of a blood clot. So sometimes we give one piece of the equation, right? And we forget, but what if not? So always there is a minimum risk with any vaccine, but not that you will get the disease. Never it has happened, not with the flu, not with this, not with nothing. That is fantasy land. And the chances of getting, whether it was the clot with AstraZeneca or pericarditis for the 13s and up, or whatever else, is negligent, comparatively speaking, to the risk of getting huge complications if you get COVID. And there is no doubt about that. And if people want, depending on how many people are interested on this topic, there are colleagues that I can reach out in epidemiology that specialize on this, that we can bring to the, and that's another piece, Susan. Maybe let's ask topics, but that the majority, and maybe we can do a poll so we can prepare for September. even if it is a poll just with yes, no now, Susan, of if people can put quickly topics that you want for September. Sorry, first of all, let me say this. We are asking to take August on and off, and we want to ask people if they're okay with that. That's number one. Just because we are rotating, some of us trying to get some vacation in the last 17 months, we haven't. So trying to do that, and then rotating schedules is complicated. So question number one, are you okay that we take August off and we resume in September? Yes, no in the chat, just very clear on that first so we don't complicate people.
So far, lots of yeses, Doris. So I think we might be able to, okay. Oh,
fantastic.
Thank you. And they're wishing us a well-deserved vacation. So thank you, everyone.
Thank you.
Okay.
So let's do the second question. If people can write, and if not, Susan, please put your email. If people can send us topics for September, but to send that before end of July, Susan, so we can prepare who. And you know what, Susan, it could be that that there are many topics and we will do 1 or 2 in September and then 1 or 2 in October, etc. So if people can either send to Susan a topic, or to Olivia, thank you so much, Susan, to send to Olivia the topics that you would like, whether it's for September, October, or November. And of course, I always will take the prerogative to augment that with things that are timely, right? Like the COVID hall is timely. The opening of schools will be timely. I can tell you, I will tackle that for sure. So if people can please, and you will likely see something from me either this week or next week on preparing schools, because I am concerned about the issue of schools for September. Not so much because I'm concerned about the September. I'm concerned that we will open September, October, and then we will close again if we didn't fix the schools. So send the topics to Olivia, please, and we will create a schedule for September, October, November, etc. And we don't plan to finish these webinars until really things are over, because I think whether it is 100 people or 80 people or 200 people, depending on the topic, I think there is a need, and it's good that we share information. Plus, we always tape these webinars and they are posted.
Actually, Doris, there's a couple more areas people have questions about. One is there vaccine being made without mRNA protein? Many people are having an issue because of the mRNA.
Well, the issue with the issue that people are confused about the mRNA, if I understood the question, if there are more vaccines than with no mRNA, is that the question, Imagine?
Yes, yes.
It's because a lot of confusion was created, and I'm not sure, I don't think it was by scientists at all. I think that was by the spin groups that created confusion, starting with anti-vaxxers, that then it became kind of, people are hearing that, right? Even if you're not an anti-vaxxer, you're just vaccine hesitant, you're just vaccine knowledgeable, you get concerned if you hear it will change your DNA. There is no such a thing.
No.
The mRNA vaccine does not change the DNA of people, period, end of story. So, are other vaccines being developed? There is the Sputnik. By the way, my older son, when he was on the lineup for the vaccine, they came to tell him it's Moderna, you know. And he kind of smiling said to the person that was telling him, right? Because people were turning away. No, I want the Sputnik. The person didn't even know what he was talking. He was just kind of laughing, right? That he didn't care which vaccine, he just wanted a vaccine. The Sputnik is the Russian one. In any case, we don't even have it here. He was just having fun. There is no such a thing about birth defects and all of that with the mRNA. There is no evidence for that. But if you want us to bring people to speak about the mRNA vaccines and how they work, we will be delighted to have that topic in. Absolutely, we do. Absolutely, we will. So, Janet, we will be happy to bring that as a topic for discussion because there is a lot of misconception. And meanwhile, I can ask a colleague to write a piece for the blog on that, or I can find some excellent articles for that and put that out.
You know, that would be good because I think a lot of nurses get asked those questions.
Excellent.
Yeah.
Excellent.
Yeah.
So just remind to send me, if PG can send, Olivia, if you can send me this full chat, a categorized chat, I will look into what other topics. That's great because it informs what I can do in the blog, and it will inform Susan and you guys on what are the topics that we can then discuss and decide on topics for September. But this shouldn't wait till September. I will write before.
Yeah. And then the last question I have, unless there are more popping up, RNAO Jeffrey is saying, and you've alluded to this, what is the position of a person's immune system who has contracted COVID? And should that person take the vaccine?
So this is very important. They do, but not right away. Not right away because it's not a priority, because right now we know that people are immune for 3 months at least, something more, but also not right away, depending if they are on cortisone or whatever else, imagine, right?
Mm-hmm.
So that is to be discussed with the primary care practitioner individually. And if in doubt, for people that need to know and you cannot find an answer, please let me know. And I have one person that to me is, and you know already, I trust the most on any of these, which is David Fishman. Absolutely. Yeah. And the reason I say I trust him more is not because I don't trust others that speak, you know, in the news, etc. I trust everybody. They're great people. The issue with David is that we have developed a relationship that I know I will get unadorned answers. You know what I mean? Not ifs and buts, but actually what's the latest on the science on it. And so if it's on a one-to-one basis, absolutely, I will respond to you. I'm more than willing to do that. So I hope that helps, Imagine.
Yeah, yeah. And someone has reminded in relation to our earlier talk, reminded us that Dr. Cora's webinar, which is on our site regarding vaccine hesitancy, was excellent and really did talk. Yeah.
And also she did a piece for the blog, so you can find 2 pieces with her.
Okay. Yeah. 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 And Susan, I think you were. Oh, and you've got the archived vaccine or archived webinars there. And then someone else has reminded us that AstraZeneca and COVID are not mRNA.
I assume people knew. I thought they were asking if additional vaccines were being developed.
Okay.
But remember, AstraZeneca, we're not giving anymore.
We're not. No. No.
Janet, you have your hand up. Were you wanting to us to unmute your line and speak? Because Olivia, maybe you can just unmute Janet and give her the chance to speak.
Sure.
And that's
that's okay.
With your hands up too. Yeah. And Janet, please put your camera on if you're able, if you're going to speak.
Oh, no, it's okay. I did not need to speak.
Okay, that's okay. To the comment of Kathy, Jude, Maureen about the complications on babies and on pregnancy, I will repeat what I said before. A healthy baby, you're right, needs a healthy mother. The risk of being unhealthy if you don't get the vaccine are substantially higher than if you get the vaccine. So that is scientific, and I'm going guided by the science. Thanks.
Mm-hmm. And there's also a comment here that in other countries, some people already vaccinated have gotten COVID. And I know you've talked about that.
I have, and
as well.
I have, and so is the video of WHO. And I said it at the beginning of this session, actually. The vaccine does not prevent you from getting COVID or transmitting COVID. I said it at the beginning, like any other vaccine. The vaccine prevents you on how serious you get COVID and how much virus you spread to others. The vaccine prevents you from dying to COVID and most likely also from getting hospitalized, although there are exceptions to that. But I don't think that there are exceptions in Canada of being double vaccinated and being in a hospital even in Canada, okay? So there is no doubt that the vaccine reduces significantly the harm of COVID for you, for your families, for your communities, and for everybody else around you, including wherever you are. So I hope that helps, both in terms of the harm on you and also the harm you cause to others. And this is why, in addition to the vaccine, it's important the issue of indoor places to continue with the public health measures that by now we all know by heart. Does that help?
I think there's
I think so. I'm just looking for who asked the question. Does it help? No, I don't have, but it certainly helps, yes. And someone's asked what mRNA stands for, and I just put it in the chat, messenger ribonucleic acid.
And I'd like to remind people about our COVID portal, because there is a section about COVID-19 vaccine information and resources. And within that section, there's a link to the Center for Effective Practice, which really is an excellent website.
And we work with them, Susan, just to remind people that we are part of the group.
Yes, so it's all the up-to-date research, and that's maintained on a regular basis. So that's an excellent go-to resource for you, and that's found easily found in our portal, the COVID vaccine portal. I'll put that link in.
I am going to put my WhatsApp in case that people at any time have additional questions. But do put your name when you send me WhatsApps, because I, number one, get tons of WhatsApps and also very strange WhatsApps from time to time. So don't be anonymous. If you ask me a question, put your name. Second, I'm going to put my Twitter, and you always can send me a direct message also, and I do respond to those as well. If I remember it, I think it's this. The Twitter is that. No, it's not that. I think it is this. That's it. Yeah, well, one needs to remember, right? So that's the Twitter, that's the WhatsApp. I always will respond to you within hours.
Doris, there's one more question here, which really is apropos our discussion of nurses' role in addressing vaccine hesitancy. How do you support parents with their decision to vaccinate their children if the risk of hospitalizations and illness is less than 1% in that age group, and who are concerned with long-term effects that are not yet known?
So the long-term effects, similar logic, the long-term effects of getting COVID, even if you're not hospitalized, are way more significant than the long-term effects of getting the vaccine and a complication of the vaccine, which is the complications are minimal and in a very small percentage. That's number one. Second, the fact that those kids transmit the disease as an adult, exactly the same to anybody around them, including back to the parents or back to grandparents or to other people. So I hope that that helps, Imagine.
Okay. Thank you. I don't see any more questions.
Yeah, I think we're quite up to date on the questions.
Raul has just asked one. Do you recommend to wear masks, wash our hands frequently, and if possible, keep social distance in the future?
I do in inside places unless you are with your own, let's say you had your grandparents, your kids' parents here. If you know that they're fully vaccinated and they're, not at the risk of contracting the virus and dying from it, that's basically it, because your kids are young, Raul. So your kids are not vaccinated that they can transmit the disease, right? But if your parents, assuming they were here, are fully vaccinated, I think is down the line safer to be inside together. I mean, I know that my grandkids, the little ones bubbled with us. So it's very different, right? They have a room here. They're kind of part of the family. But the older ones, when they were in school and they were not vaccinated, they were not allowed to come here. End of story. Now that we are both vaccinated, even before we go together in August together to a cottage, they are going to stop to go to camp because we are super safe, right? And then we want to be together. But right now they're going to camps. Now, if it's outside camps, it's less of an issue because again, outside you do not catch the virus the same as inside. But if it's indoor camps, that's different, right? And some kids are going indoor camps, right? The issue of the key that you need to remember that this is aerosol. So it translates by when you laugh, when you talk, when it's through saliva droplets, right? And people don't realize, but when kids speak, I don't need to tell you, right? It's whether the bracelets or the whatever, right? And this is why we express concern, and you will see that on my blog, not so much about the fact that we advanced 5 days, the reopening of the third wave, of the third phase, because we met the parameters of how many people needed to be vaccinated and double vaccinated, but because we didn't put limits on restaurants. So we say 2 meters apart, but there are no limits on how many on a table. And what happened if it's friends from different, teenagers. I don't need to tell you, right? And when you mix alcohol in the mix and you start to laugh or do karaoke or I don't know what, that's from where our concern is coming in inside places. I hope that helps. So I always think, thank you, Nicole, for coming, and thank you for thanking us. And we thank you. We always think, we always tend at RNAO, and certainly me as a CEO with our staff, to be more cautious than not. Better to be safe than sorry, I keep saying to people, because getting COVID is not fun. Not fun for you, for your family, for your worries, for your everything, right? And not fun for the consequences now that we know more and more about that. Read that blog, is scary. So this is not just when one time there was a minister that said it's like a flu. No, it's not like a flu. Certainly.
Well, that relates to a question by Stephanie. With the COVID strain continuously mutating and causing variants of concern, do you think COVID is here to stay like the new flu?
Yes,
what
I
do you
do. Yes,
and
I
then
do.
second question, what do you think about Singapore, who wants to stop counting COVID cases because they believe it's the new flu?
Well, first of all, the flu has a vaccine, as you know, every year that shapes according to the strain of the flu. And I think here there will be similar, right? The difference between, there are many differences, right? On the impact of the flu versus the impact of COVID and the strains that are mutating and the fact that a strain may come that is even less reactive to the vaccine. Every strain that comes is 50% worse than the previous one, right? So I think our focus should not be only on what Singapore does for them and what Japan does for them and what, Canada does for us and Australia and the other rich country does, versus let's help the poorest countries of the world to get double vaccine, first of all, first dose, so they don't die in the numbers they're dying, and also double vaccinated, so we put a brake a bit on how this is mutating this fast. It's mutating very fast, guys. I just mentioned to you 2 of the serious ones, but there are many, many more mutations. So I think we need to continue to count. I think we need to continue to monitor what this is doing to our health system. There are people with other conditions outside of COVID that need those ICU beds. We need to continue to monitor the resources we need so we can bring the health system and the economy to some type of normal, and the two go side by side. They don't go like this. This was an error at the beginning, that we made the economy and health system and protection of the public go as if one was against the other. I always try to explain to the premier they are parallel. The more we protect people from getting COVID, the better we do with public health measures. And today that includes the vaccine, but it continues to include other protections, both by us as individuals to be careful or not getting in a bus without a mask, or whatever else, right? Not getting together with 200 people in an indoor place without a mask. The same as the government. And vaccination. Then we will continue to be able to have some level of economic activity and also social activity. I'm surprised that one question has not come up, and I will leave you, I don't know how we are doing on time, but I want to leave you with some thoughts on that. And it's the issue of mandating in workplaces to disclose if you are vaccinated or not. I'm talking about healthcare workplaces. So there was an article. First of all, there are issues in long-term care, as you know. There were an outbreak 2 weeks ago, and then I think again last weekend in another place. And there is also the question about other institutions, hospitals, for example, where you have people with immunosuppressed systems, right, because of cancer or other conditions that they're treated. And they want to know if their staff have been vaccinated. I can tell you, I went finally to my regular mammogram on the weekend. You know, I decided, okay, things are better now. It's time to get it done and not regret later. I have it every, you know, it's part of the routine that I need to do, not because I have had anything, but because of, I don't want to have anything. In any case, I absolutely ask. I went to do my clinic appointment. I asked before I went. I want to know if the person that will see me is fully vaccinated. They had no issue telling me. They had no issue telling me. And they didn't ask me about me, but I offered. I said, you need to know I'm fully vaccinated over 28 days. And they were delighted to know. Because imagine you're doing a mammogram. I don't know how many of you have had a mammogram, but I don't need to tell you how close you come with the person. I wanted to know. And I knew that that person likely wanted to know. Same with the dental hygienist. That person will want to know, like they're afraid equally as us, right? They were delighted to know, and we were so comfortable after. Still, I was with the mask and she was with the mask and with the face shield, you know, not for the hygienist, but for the mammogram. I think that people more and more, patients more and more, families more and more will be asking to know. And I think some workplaces will say you have a choice. You have a choice. I'm not saying for people that don't work facing patients, but I do think people want to know that they're safe and that their loved ones are safe. I would love to know on a scale from 0 to 10, if people agree with the position that we are forming at RNAO. 0 being totally don't agree, it's my business if I'm vaccinated or not, and 10, yes, patients and families have a right to know. If you can put your numbers, it will give us an idea to see how we are. And don't feel embarrassed to say you are a 0 if you are a 0. Any more people that would like to tell?
A slippery slope.
Well, it's slippery slope in terms of privacy, right? But I think it's the privacy of the individual versus the collective, right? And the reality is people have a choice, there are people can work on an office, etc. But I think if you're frontlining patients, I don't blame patients that they want to know. I don't, because if I had someone, and I do, people that I love in hospitals, I definitely would like to know that they're safe, at least from the virus. You know what I mean? Especially.
Well, I was just going to say in some units, like I believe in mental health units, you have to get the vaccine.
I think, so the answer to me at Sinai, Imagine, when I asked, because I asked the receptionist and she told me the answer. She said, absolutely, she's vaccinated, that the sonographer was vaccinated. When I asked her inside, she said to me, oh, everybody's vaccinated at Sinai. They told us we need to. It's only people that work from an office that have a choice, but not us. And she was totally okay with that. Totally okay.
Yeah.
Because that means also they're first in line to get the vaccine, right?
Yeah, see, here we have again that friends are starting to go into work, open concept, masks not mandated, and no one knows if they're vaccinated or not.
Well, I can tell you, and my colleagues at RNAO know, guys, that at RNAO, no. Whoever will not be vaccinated, which I hope is 0, will need to wear a mask and a face shield. In any case, that's very good pulse that you guys are giving us. I appreciate that. Excellent. Thank you for letting us know.
Yeah.
Very good. Anything else that is outstanding from questions or comments?
I don't think so, Doris.
I do want to comment on Lisa. Lisa, you're right. Flu shots are not mandatory, but organizations have a right to say, if you didn't get the flu shot, you need to wear a mask.
Yeah.
And that is totally allowed by employers.
Yeah.
So,
and Naomi said they must disclose and they must take a medication.
No, not a medication. They must take an education. That's the type.
Oh, education. That was an error. Yes.
Yeah, but
okay. I was worried.
The education is only allowed, it's only mandatory in long-term care. It's not in hospitals. And we need to make it mandatory.
Oh, no. You said, Naomi, they have to take some pills.
No.
I don't know.
No. If you know of anything like that, please send me an email because I'm not aware of that at all.
Yeah. So Naomi Pirsa, you send an email about that. Okay. The only other thing, and Raul has mentioned it twice, is, she says it was a medication. Oh, gee.
Okay, she needs to send us a note.
Yeah.
And please don't give it legs because I'm not aware of that. Not for the flu and not for anything.
Yeah.
Maybe there is a specific workplace that does it.
Yes, I think so.
Yeah.
And Raul has asked a couple of times about the fact that the incidence of flu was down last year. Probably due to masking, hand washing. And do you think that will be customary in the future?
Well, I think if that can be the silver lining of COVID, that will be amazing. But you want to have a good laugh. I feel embarrassed to say it now, but it's true. So when COVID started, we were the first out the door in the media, even in January of well over a year ago. when we heard about China because of our colleagues in China, was not even in the media. Marianne and I got together and put a statement in the website. And then, of course, people started in some places to wear masks because people, you know, saw what China was doing. Well, I thought at the time, well, wouldn't that be nice for next year? I thought, well, next year now is past, right? Way past. And we still have COVID. It tells you that some of us thought that COVID will be done in like 10 months. Not so, not so. But will be nice if it's a silver lining of COVID, that we continue to protect ourselves during flu season with a mask, with washing our hands, because the flu gets transmitted, you know, in many, you know, in the subway, in the bus, in the, you name it, workplaces, homes. It will be nice if we can keep the flu down as a result of this, right?
Okay, Doris, I think that we've reached the end of the questions. Lots of people grateful for the webinar today. And I just wanted to remind you that our next webinar is going to be in September. So we're taking the month of August off in some way for not having this webinar, but please join us on September 13th. And we will have the registration up for that. So you can register in advance with the topic to be clarified later. And just a reminder that we are interested to hear the topics that you would like to talk about for September or beyond. And you can send those by email to Olivia.
And if there are other topics in addition to COVID that people are interested, I am now that I have a bit more time to think about other things, I am getting very, very interested at some of the information I am reading about cancer and cancer prevention versus cancer cure, and about some of the issues going behind the scenes with that, some of them quite concerning, and some of the dietary habits that we have, which in some instances people are avoiding to talk about that, and the focus continues to be on cure and not on prevention. So maybe at some point we can touch some of that and can also bring some very important speakers on that, plus some information on that. So we take, you know, other aspects of public health measures, including the issue of how social determinants of health impacts, for example, on cancer and nutrition, right? Much easier if you need to go out and you don't have money, but you want to take your family for an outing to go to McDonald's than to buy good veggies and do something nice with good veggies, right? In any case, that's other topics that we can touch in future months to come.
Good. Lovely.
Okay, we are good to go.
We're done. Okay.